Patients, as you're saying, can get very used to their symptoms and it's just their normal. And that's tragic. But what happens and how often does it happen when Chiari symptoms or syringomyelia symptoms come on very fast, very acutely? Because I'm sure that can be very, very scary. And at what point, how do you know what's an emergency situation for a Chiari patient or a syringomyelia patient?
Yeah, that happens. That happens. I'm thinking of a 7-year-old girl who, had no symptoms, did a handstand, fell down, paralyzed on one side of her body, and was, at least weak, paralyzed 2 week over about 3 days. It didn't just immediately go away. And she turned out to have a Chiari and massive syringomyelia throughout the spinal cord. People have come in with presentations of stroke or a TIA and thought they were having a stroke, and it turned out to be Chiari. So no, the symptoms can just all of a sudden come on. Nobody knows why. Nobody knows why someone who's been asymptomatic, into their 30s, 40s, 50s suddenly develops symptoms that don't go away. But yes, it does happen.
So a question came in. Oh, it's a doozy. Does a released tethered cord have a higher chance to retether when a child has a pubertal growth spurt? So if they were currently retethered but not super symptomatic, could it physically cause them to not to grow as much? Oh, interesting. So can the tethering stop their growth or slow it?
Not that we know of, but if someone is tethered and doesn't get untethered, has a growth spurt, they are likely to develop scoliosis, and that will cause their height to be less. So the person's not growing less, but they may develop, scoliosis and be shorter from that standpoint. The spinal cord is untethered, and then, the scoliosis straightens. I would wonder if it's known scoliosis in a growing child. I would really strongly recommend untethering it so that you don't have that kind of problem, worsening of symptoms. I mean, that's why we do it in young children, because as they grow, there will be increased tension on the spinal cord, increased stretch, and they can develop, problems like, foot abnormalities, curvature of the foot and ankles, trouble with walking, stumbling, and then the back pain and the bowel and bladder problems.
So is it more likely for a cord to retether after like a growth spurt in pubescence or adolescence?
Yes, and they become more symptomatic. So the spinal cord has been untethered right around any of the growth spurts, 2 years old, 5 years old, about 10 to 12, and then again 15 to 17. After 17, 18 years old, people usually don't grow much. There are exceptions, but usually they don't grow much after that. So then I typically see patients every year with that I've done a spinal cord untethering until they're 18. And then after they're 18, then they just come back if they have problems.
So I think to wrap up, I'm going to kind of come back to something we talked about in the beginning, where we're in this weird time where everything's being done by telehealth and people are seeing people across the world and across the country. So this is really a question, I guess, more for you and your practice. Are you doing remote consults? So maybe a patient in, like, I don't know, Montana, or even further, maybe Florida, or maybe they don't want to travel right now, but they are interested in seeing you. Do you do remote consultations in that way?
I do,
Okay.
and that's been very common right now with what's going on. I don't like to, I really don't operate on somebody that I haven't seen in person at least once. I prefer not to see new patients by telehealth, just because there's only so much you can do as far as exam.
Right.
And checking reflexes is important. Checking, sensory exam is important. Sometimes there are real logistic problems, but I pretty much insist on seeing somebody in person at least once before I do an operation on them.
Well, it's a very personal thing, so if you want the FaceTime, I would. But that's good to know. And I honestly, if someone was going to do something remote, now is almost the time to do it because it's a little bit easier logistically, well, not logistically, but regulations wise because they've relaxed a lot of stuff because of the pandemic. Um, but that's good to know.
The
So
best patients for telehealth are the follow-ups that I know
right,
well, that you know, maybe we're going to make a decision about whether we need to order another MRI or not,
right.
or they're doing great. But I'm not likely to, have to really explore anything that we haven't talked about before.
Hmm. Um, as a final question, if a patient who, especially if they were a patient of yours in the past, if they're suddenly starting to have some problems and they're scared to go to the hospital for all the reasons we talked about before, which they shouldn't because I know the hospital is one of like the cleanest places right now. But how do they safely go about getting an MRI or in any sense like that? If they have to get some, I don't know if it's tethered cord, they need urodynamics testing. It What's the process for that? Is it something that they need to prepare for extra right now? And what would you say?
Well, yeah, I think you're right when you say the hospitals are among the safest places now. Um, People really need to get their routine health care taken care of. They really need to get their imaging. They shouldn't put it off for fear of COVID. Every hospital that I know of that I go to has sort of designated COVID areas,
Mhm.
and they work very hard to make sure that no patients with COVID are kept in non-COVID areas, even just in the ER, like from just walking in the door. So they're really doing a good job of isolating patients who might have it, even being suspected of having it. The X-ray and MRI techs are wiping down the machines, the tables, everything between every patient. Everyone is using masks and gloves, and it really is pretty safe. And
Okay,
it's more dangerous to have progressive symptoms and not get an MRI than to just go ahead and get it done.
absolutely. Well, that was awesome. So I want to thank Dr. Gilmer for being with us tonight. And I don't know if there's anything you want to mention before we
No,
go.
thank you.
Okay.
Thank you. It was fun. I love talking about Chiari and
Do
Syringa.
you?
I could talk about it all night. So thank you very
Awesome.
much for your attention.
Thank you all for coming and thank you, Dr. Gilmer.
You're welcome. Bye bye.
Bye.